This video is all about administering oxygen via the nasal cannula. So what is the purpose? So the purpose is to deliver low to moderate levels of oxygen to relieve hypoxia. So for the assessment and procedure, first is we need to assess for the respiratory status, just like the breath sounds, for the respiratory rate and depth, for the presence of sputum, and then ABG if available. And also, we need to assess for the past medical history of the patient, noting if he or she had COPD or chronic obstructive pulmonary disease. And the next is we need to assess for its clinical signs and symptoms of hypoxia, just like anxiety, decreased level of consciousness, for the inability to concentrate, for fatigue, for dizziness, for cardiac dysrhythmias, pallor or cyanosis, and then for dyspnea. And then what are the equipments to be used? Of course, we need the oxygen source, flow meter for the no smoking sign, and also for the nasal cannula. So for the procedure, first up is we need to review for the physician's order for oxygen. The rationale for this is to prevent potential error. And then next is we need to wash our hands because hand washing reduces the transmission of microorganisms. Before that, we need to introduce ourselves to the client. So, good day, ma'am, sir. I am Janice Asuncion, the student nurse assigned to you today. Um, Today, I will be administering oxygen to you via the nasal cannula. So, next is we need to identify the client. And then, we need to explain to her the procedure. And the next is we need to explain to her that oxygen will ease dyspnea or discomfort, and that we need to inform him or her that for the concern or her concern for the safety precautions associated with oxygen use. And then lastly is we need to encourage him or her to breathe through the nose. And then next is um, I'll be now doing or I will now administer oxygen to her via nasal cannula. So for the first step is that we need to assist the client to semi or high Fowler's position because this position facilitates optimal lung expansion. Next is we need to insert the flow meter into the oxygen. Then we need to turn on for the oxygen at the prescribed rate. And then we need to check if oxygen is already flowing through the tubing because oxygen must be administered as prescribed. And then we need to hold for the nasal cannula in its proper position with prongs curving downward. And then next is we must place the cannula prongs into the nares. So there, and we must place it behind the ears. And then we need to adjust for the plastic slide under its chin until the cannula fits snugly. And then we need to place for the gauge at the ear beneath the tubing because proper placement of nares ensures accurate administration of oxygen. And then if the prongs dislodge from the nares, we need to replace it immediately because the rationale for this is to ensure the correct oxygen delivery and to prevent hypoxemia. So we need to assess for the proper functioning of equipment, and then we need to observe for the client's initial response to that therapy. And then next is we need to, because the rationale for this is that assessment of vital signs, oxygen saturation, the color, breathing pattern, and orientation helps the nurse evaluate for the effectiveness of the therapy and then to detect clinical evidence of hypoxia. So we must monitor continuously the therapy by assessing for the pressure areas, on the skin and nares every 2 hours, and then we're checking for the flow rate for every 4 to 8 hours. Because the rationale for this is that it permits early detection of skin breakdown or inadequate flow rate. So that's how we administer oxygen via the nasal cannula. So after doing the procedure, we need to do the hand washing again. Thank you.